Now let's talk about the actual oxygen and CO2 transport. How do we move these? So we know that oxygen diffuses in and CO2 diffuses out, but let's look at this. So if I think about hemoglobin, hemoglobin is that 4-part protein that we looked at before, and we see that if we measure the concentration, now when we talk about concentration of oxygen, we talk about something called a partial pressure. If total air volume is 760 millimeters mercury of pressure at sea level, 80% of that is nitrogen, which we don't use, and only 20% of it is oxygen. So we have this partial pressure of about 100. And at 100, you'll see that they say hemoglobin is about 98.5% saturated. It's almost fully saturated. And the drawing on the A drawing shows that we have a few molecules of oxygen kind of dissolved in the plasma. We don't dissolve a lot, and most of it is attached, and only one little spot on the hemoglobin in that erythrocyte is open. But if we go, so this would be in the lungs. This is what happens in the lungs. However, if I go out to your tissues, you see it says venous blood. This would be systemic, right? We've delivered oxygen, and you'll notice I didn't empty one and leave others full. I took 1 out of 4 for each of these. And we'll see that we have less saturated. So I only have 2 versus the 5 I had over there. So my partial pressure has dropped to 40. And in that 40, my hemoglobin is only 75% saturated. That means for the drop in pressure or concentration from 100 to 40, I've used 25% of the oxygen. So even in the veins, you still have 75% of your oxygen. So this picture shows that in the lungs, we come in with 40. We have a great concentration gradient, 100 versus 40. And the lungs are so good at getting oxygen onto the hemoglobin that the partial pressure in the blood is 100, which gives us that 98.5. I've seen 99. But oxygen having this alveolar wall, these are the type 1 cells here that are so thin, and the capillary endothelium, very thin. So oxygen doesn't have far to diffuse, and it's able to join the hemoglobin on the erythrocyte. Then we go out to the systemic tissues, and we see the opposite, where we're coming in at 100, right? And what happens is, because the tissue cell is over here at 40 as its concentration, and if this is 100, we again have that 100 versus 40 diffusion gradient. Blood flows into the tissue cell, or oxygen flows into the tissue cell, blood leaves going at 40. So we have great concentration gradients as the driving force for oxygen movement. Now, this is called the hemoglobin oxygen binding curve. It shows the percentage. And you'll notice it's not a straight line. Because of the way oxygen binds to hemoglobin, it's what we call cooperative. So that first or last one off, like the last one on is the first one off, we see that it takes a drop of this 100 to 40 partial pressure concentration to deliver 75% of, or to drop the saturation into 75%. So we're going to deliver 25% of the oxygen we carry. But if for some reason the tissue has a further decrease in concentration, you'll notice that this curve gets very steep, and we can deliver even more oxygen for very small change. So if I go to 60 here, this is about 35. So it took a 60-fold change to deliver 25. But for another 5%, I can deliver another 15. So the body has a great ability to deliver more oxygen if the tissue falls even lower. Say during activity and we're using more oxygen, we can deliver more oxygen. It's there. Okay? You're not running out of oxygen. So how much oxygen are we talking about? In a normal 1 liter of blood at rest, you have about 197 milliliters, I should have put here, of oxygen on the hemoglobin. And we only have 3 milliliters dissolved. This is your 98% saturation right there. And if there are 200 milliliters total oxygen, and this is at 100 millimeters of mercury as our pressure of oxygen. If I think about, if that's 1 liter and I think about, okay, normal blood volume is 5 liters, I have 1,000 milliliters of oxygen in the body. Or since it's 5 liters per minute traveling through the body, I'm delivering 1,000 milliliters of oxygen every minute to your body tissues, but we're not using it all. So I drew this drawing because I couldn't find a better one. So I said we have about 105 to 100, depending on who you ask, of oxygen in the lungs. And we get this 100 here in the artery. So this is the artery. And this is the left side. So blood is traveling through this artery. And I reminded you that's 200 milliliters per liter of blood, or 1,000 milliliters of oxygen every minute. When we get down to the tissues, we have this concentration of 100 versus 40. And I'm pointing out that we delivered 25%, or 250 milliliters of that oxygen is delivered. And the blood that's leaving, what we consider deoxygenated blood, still has 750 milliliters of oxygen. It still has a lot of oxygen. Okay, it has 75%, and yet we call it deoxygenated. It's less oxygen, but the oxygen isn't gone. And I stress this because when people hold their breath, they think, oh, I have to breathe because I'm running out of oxygen. No, you still have 75% left, and it's deliverable. What changes is the carbon dioxide, which we'll deal with in a moment. So keep in mind, we're only using 25% of the oxygen every minute.